Hello guys, welcome to my YouTube channel Ambitious Dr. Ashwini, and today we will see the next protozoa, that is Trypanosoma cruzi. So Trypanosomas comes under flagellates. So the contents today we will see: describe the morphology of Trypanosoma cruzi, describe the life cycle of Trypanosoma cruzi, describe the pathogenicity of Trypanosoma cruzi, describe the clinical features of Chagas disease, and describe the laboratory diagnosis of Chagas disease. Firstly, we will see the introduction. A protozoa parasite, tiny single-celled organism, causative agent of Chagas disease, American trypanosomiasis, transmitted by the radioid bug, also called triatomine or kissing bug. Geographical distribution, found mainly in South America, Central America, and Mexico. Common in rural areas, especially in houses with cracks or poor construction where the bugs hide. Habitat in the human body. Muscular tissues, especially the heart muscles, nervous tissues affect the nerves, and reticuloendothelial system includes organs like liver, spleen, and lymph nodes. In short, Trypanosoma cruzi causes Chagas disease, spread by radioid, that is triatomine bug, found in South America, lives in muscles, nerves, and immune system tissues. Now we will see the morphology of Trypanosoma cruzi. Shape: similar to Trypanosoma brucei, appears C-shaped or U-shaped in stained blood films. Measures about 3 micrometer into 3 micrometer in blood, found in the trypomastigote form, and does not multiply in peripheral blood. In tissues, inside cells of striated muscles, heart and skeletal muscles, neurological cells, and reticuloendothelial cells. Exists as a mastigote, forms small, round, or oval bodies, 2 to 4 micrometer. Each has a nucleus and a kinetoplast, a DNA containing structure. Multiplication occurs only in the amastigote stage inside the host cells. In short, it is C or U-shaped in blood, 3 micrometer into 3 micrometer in size, no multiplication in blood. A mastigote forms 2 to 4 micrometer in muscles, nerves, and reticuloendothelial cells. Multiplication only in a mastigote stage. Now we will see the life cycle of Trypanosoma cruzi. It has mainly two hosts. First one, human or vertebrate host, which is the definitive host. It has a mastigote and tri- trypomastigote forms. Radioid bug or vector. It is the intermediate host. It has epimastigote and metacyclic trypomastigote forms. Vector, transmitted by the radioid bug, also called triatomine or kissing bug. The bug acts as the intermediate host. Infection to humans. When the bug bites a person, it defecates near the bite site. The infective feces enter the body when a person rubs or scratches the bite area. Infection can occur through the conjunctiva, eye, or other mucous membranes. Inside the human body, the parasite enters cells, especially muscles, nerves, and reticuloendothelial cells, converts into a mastigote form, multiplies inside cells, then changes back to trypomastigote form, released into the blood, taken up by another bug. Now inside the bug. When the bug bites an infected person, it takes up trypomastigote forms from the blood. In the bug's intestine, these forms changes into epimastigote. Epimastigotes multiply and then transform into trypomastigotes again. These infected trypomastigotes are passed out in the bug's feces. So this is the diagram of life cycle of Trypanosoma cruzi. Triatomine bug takes a blood meal, passes metacyclic trypomastigotes in feces Trypomastigotes enter bite, wound, or mucosal membranes such as conjunctiva. From here, metacyclic trypomastigotes penetrate various cells at bite, wound site. Inside cells, they transforms into amastigotes. Amastigotes multiply by binary fission in cells of infected tissues. Intracellular amastigotes transforms into trypomastigotes, then bursts out of the cell and enter the bloodstream. From here, triatomine bug takes up a blood meal. Trypomastigotes ingestates. From here, they transforms into epimastigotes in midgut, multiply in midgut, and metacyclic trypomastigotes in hindgut. And in this way, the life cycle goes on. Here, trypomastigotes can infect other cells and transforms into intracellular amastigotes in new infection sites. Clinical manifestations can result from the infective cycle. So, in short, the vector is radioid or kissing bug. Infective form is trypomastigote in bug feces. Entry through bite, wound, or conjunctiva. In bug, trypomastigote transforms to epimastigote to trypomastigote. In man, a mastigote multiplying form to trypomastigote circulating form. Now we will see the pathogenesis of Trypanosoma cruzi. Entry into the body. Infection occurs when infected trypomastigotes from the bug species enter through skin wound, bug bite site, conjunctiva, or other mucous membranes. Second, local reaction, chegoma. At the site of entry, local inflammation and swelling occur called as chagoma. If near the eye, causes Romanas sign, swelling of eyelids and conjunctiva. Invasion of cells. Trypomastigotes enter cells of muscles, nerves, and the reticuloendothelial system. Inside cells, they change into amastigote forms which multiply actively. Cell damage. Infected cells burst open, releasing more parasites, which is trypomastigotes. This spreads to new cells, causing tissue destruction and inflammation. Major organs affected: heart, myocarditis, heart muscle damage, chronic cardiomyopathy, digestive tract, damage to nerves causes megaesophagus and megacolon, nervous system, neuronal problem, which is neurological symptoms. Stages of disease: acute stage causes fever, lymph node enlargement, swelling at bite site. Chronic stage after years, heart failure, arrhythmias, and enlargement of digestive organs. In short, entry through bug feces, wound or conjunctiva, local swelling, chegoma or romana sign. Parasite enters cells, multiplies and cells burst. Affects hearts, nerves, digestive system. Leads to Chagas disease, acute plus chronic stages. Now we will see the clinical features of Chagas disease. Incubation period is about 7 to 14 days after infection. Early stage disease. Appearance of a painful subcutaneous nodule at the site of entry called chegoma. Unilateral, painless eyelid swelling called Romanas signs. When infection occurs via the conjunctiva. Acute Chagas disease. Seen in about 1% of infected patients, symptoms are fever, hepatosplenomegaly, enlarged liver and spleen, lymphadenopathy, enlarged lymph nodes, may last for a few weeks to months. In severe cases, myocarditis or meningoencephalitis may occur. Chronic Chagas disease. The parasite multiplies in muscles, cardiac, GIT, and nervous tissues, causing long-term damage. Cardiac form, dilated cardiomyopathy, which is enlarged and weakened heart. Cardiac rhythm disturbances, which is arrhythmias. Then gastrointestinal form, damage to autonomic nerves controlling the GIT, causing megaesophagus, enlarged food pipe, swallowing difficulty. Megacolon, enlarged colon, cause constipation, abdominal distension. Congenital Chagas disease, rare transmission from mother to fetus, which is transplacental. may cause low birth weight, stillbirth, myocarditis, which is inflammation of the heart, and neurological abnormalities. In short, early chagoma romana sign, acute fever, splenomegaly, and lympho, lympha, sorry, lymphadenopathy, chronic cardiac cardiomyopathy, arrhythmia, GIT, megaesophagus, megacolon, congenital, which is rare and may cause fetal heart and brain damage. Now we will see the laboratory diagnosis of Chagas disease. First one, peripheral blood smear examination. Thick and thin smears are examined under a microscope. Findings, presence of trypomastigote forms of Trypanosoma cruzi. Size is about 20 micrometer long. Shape characteristic C-shaped or U-shaped appearance. Kinetoplast, large and terminal at one end. Posterior end which is short and blunt. Other diagnostic modalities include culture method, serological tests, molecular methods, animal inoculation, and xenodiagnosis. So, this was all about Trypanosoma cruzi. Please like, share, and subscribe to my YouTube channel, and don't forget to press the bell icon for more updates. Thank you.